November 2007, I was injured at home. I was putting up Christmas lights, taking down a ladder, and was distracted and lost my balance, and the ladder, as I was taking it down, fell. I tried to catch the ladder, kept it from hitting the house. I caught the ladder, but as I caught the ladder, my left arm, I suddenly felt it stretch out over 180 degrees and a sudden snap, and I had instantaneous injury to my arm, pain to my arm. Set the ladder down, went inside, told my wife, I said, I think I hurt my arm pretty bad, and since I've got an appointment with my doctor tomorrow morning, I'll go see him.
And so what kind of initial treatment did you receive for that?
Initially, my primary care physician took x-rays of my neck and found out my neck was okay, took x-rays of my arm, and the arm looked okay. However, I had extended bruising and my arm was very painful. He referred me to orthopedics. He referred me to physical therapy at another location, and nothing seemed to help. He also referred me to pain management at different pain management facilities throughout the Kansas City area. Nothing seemed to work. I finally was referred to a neurosurgeon at a pain management clinic. He said that I had ruptured disc in my neck that was causing the pain going down my arm, and wanted to do surgery. I sought a second opinion from another neurosurgeon. They said the same thing. I trusted the opinion of this particular physician and had a fusion done C4 through C7 on my neck in February of 2008. Unfortunately, the pain wasn't relieved, and I had gone back to my primary care physician and specifically said that I would like to be referred to Dr. Shane Jackson, because I've known Shane since 2004 when I was treated for another time with him when he worked prior to where he used to work. And within 15 minutes of my initial visit with Shane Jackson, he told me, he said, without an MRI, I am 99% sure that your neck, while you may have had ruptured disc in your neck, had nothing to do with the pain that you are experiencing in your arm. He says, I am 99% sure that you have a distal tendon bicep rupture in your arm. He said that there's a chance that it could be in the upper shoulder or at the elbow. He says protocol said that we'll have to check out your upper arm first, your upper shoulder. He said, but I believe that it's located in your elbow area. Sure enough, in May of 2008, when I saw Shane, he diagnosed it correctly, and within a couple of weeks we had the MRI results, and I had a distal tendon bicep rupture. The problem with it at that point was, by the time I had finally saw Shane, the accident had happened in November. The muscle had atrophied to the point that it could not be reattached. Since then, I've been seeing Shane for pain management and for therapy, and while I still have pain, the pain is tolerable. The management and the therapy, I have movement in the arm, and I have use of my arm, whereas before I didn't. And Shane has just been remarkable in his treatment and what he's done with me, and I can't speak highly enough for what he has done. What I really enjoy working with Shane is Shane takes the time to work with his patients. He does not, it's not a rush process. Shane makes sure that he deals with the issues, he listens to the concerns of his patients, and makes sure that they understand the therapeutic exercises that will help them get the best results. And my experience with other physical therapists is that it's a conveyor belt process. in and out, get you in and out. I've got somebody else to see, and I have never felt that way with Dr. Shane Jackson.